We know he's a beast, but we don't want him to feel that much pain while he's having surgery. As you know, Eddie Hall recently had surgery. He ruptured his biceps tendon, and he had the surgery while he was awake. I have had a lot of patients that have been talking about this. Hi, I'm Dr. Puja. I thought it'd be fun to make this video. We're gonna go through the video and watch it together. This way I'm gonna explain some of the medical jargon, and it'll just be fun so we can better understand what happened. Let's go. Okay, so right here, he's examining his tendon. So the thing that the doctor, like where he has his thumb right now, that's his distal biceps tendon, and that's what he ruptured, and that's his injury. So right now we're gonna watch the doctor examining him, and he's moving his arm. So this is the good arm. Right there, I want you to pay attention right here where the doctor has his finger. That's the tendon that was ruptured. He's going over it and he's literally telling Eddie that, hey, your tendon no longer is attached to your bone. They used an ultrasound to take a look at it. Okay, so the doctor now, after he's done with his examination, he's gonna, have a consultation with Eddie and kind of tell him, hey, this is what I think is going on, and this is the kind of surgery that you're gonna have. So what I want you to know, like minus the camera guy, it's important to have a pre-surgical clearance. So that's an office visit that you usually would have either with a cardiologist, your general doctor, and then with the surgeon that's going to do the surgery. So one of the things that I want to kind of bring up is that we really try to ask questions to make sure that your heart is able to tolerate the surgery. So say, for example, if Eddie had some really bad heart disease, if he had heart failure, if he had some really weird arrhythmia that was not controlled, or if he had, severe sleep apnea, because the surgery isn't a emergent surgery, they would probably postpone this for another day, because you want to make sure that your heart actually is able to tolerate the procedure so you don't die on the table, because anesthesia puts such a huge load on your heart. Okay, so we're now at the part where the doctor is explaining to Eddie, like with the picture of what he's gonna do. And I think this is absolutely cool. So right here, this little thing that you see, that's supposed to be his biceps tendon. And with a button, literally like a, tiny, sturdy button, they're going to do a distal surgical repair on his tendon. And they're gonna attach that tendon back to his bone. So basically what tendons do is they attach your muscles to your bones. And this is such a beautiful part of the body over here because there's so many muscles here that allow you to move your hand in certain ways. This is called the antecubital fossa. I don't know what this is called in non-medical terms, but again, there are lots of little muscles. There are lots of important muscles in this area. For example, you have your flexor muscles, which attach to the bone here. You have your brachioradialis muscle, which is much deeper to your biceps muscles, which actually allow, so they connect the top part of your arm to the lower part of your arm, and they allow you to do this type of a maneuver. Okay, so we're just watching him draw it a little bit more, and he's like, yep, there's the button, and we're gonna reattach it to the bone. Okay, so basically he's just telling you, hey, I'm gonna tack down your tendon to your bone. Let's move on to the next part of the video. Okay, so I think what Eddie's doing here is absolutely awesome. And the reason is, he's using social media to really help talk about his disease, just bring more exposure to it, help reduce any type of stigma that might be there. But what I want you to know is that the reason why doctors are so crazy about your privacy is because it's not really for our benefit, it's for your benefit, making sure that your privacy is respected. Think about it, if you're having surgery, you wouldn't want just a group of people there with a camera. We wouldn't want people just passing out if they're squeamish from the blood or what have you. So I think, it's really cool that Eddie's doing this, but I want you to realize that, the privacy things, we're not trying to be tough. It's really just for the patient's benefit. These aren't really, we're going to go over these graphic images together, so don't worry. Okay, so right there. Okay, so I'm going to tell you what's going on over here. So what Eddie's getting here is a regional pain block or a peripheral nerve block. Basically what it is the guy, this is the anesthesiologist likely, he or she, I think it's a he because of the hairy arms. I know it's a he because I watched this video before. So he's injecting pain, like numbing medication. Some of the medicines in here are very short acting. So lidocaine is a short acting type of medicine. That's what you would get like at the dentist. That usually lasts for about 30 minutes or so, but they're going to put much stronger numbing medications in there. Sometimes those numbing medicines can last up to like 2 to 3 days or so. Okay, so it's not that it's really hurting. So I don't know, like you may have heard this at your, like if you've had a skin procedure, usually with topical anesthetics, so like the kind that kind of squirted on him in the beginning, and when he made that face, you're usually gonna feel like a burning sensation. And I mean, I don't think it's gonna hurt him that much. Okay, right there. So this is the medicine. This is the person that's going to squeeze the medicine into him, and that's going to help prevent him from feeling the pain. We know he's a beast, but we don't want him to feel that much pain while he's having surgery. Yeah, so this is really good. That's a question that your doctors may ask you a lot of times. It's super important to let us know if you are experiencing pain or if you're feeling like a pressure sensation. In our body, pressure sensations come from different receptors and pain sensations come from different receptors. So it's super important to let us know, hey, is this like a pokey, sharp pain or is this like a pressure pain? Okay, so right here is an ultrasound, and the reason why they're doing the ultrasound, I mean, this is very important. When they're putting in all of that anesthetic medication, and the goal is you want that anesthetic medication to go and bathe the nerves. You do not want this pain medicine going into your subclavian artery, to your artery that's right here, because this is going to go to your heart, and this is not a good thing. That's why medical school and residency and fellowship, all that training takes a long time. Okay, so from here, Eddie is going to the OR. So the hospital setting is sort of like an assembly line. You first go to anesthesia, and then after that you get prepped, and then you go to surgery. So everything doesn't happen all in one place. Think of it like as an assembly line. Okay. Okay, so over here, he's getting a good scrub down. And this is a very important part of any type of surgery. I'm going to pause it right here. Like the yellow color is likely from the iodine that they're applying to his arm. Usually when we think of any type of pre-surgical cleansing to make the skin sterile, we think of iodine. But there are also different types of soaps and scrubs that can be used. Chlorhexidine is one, Hibiclens is another, so it's not always iodine. But this is a very important step of any procedure. That's this doctor's favorite procedure. So Eddie over here says that it feels a little bit surreal. And yeah, I mean, I want you to know that our bodies are absolutely amazing. Like we have a billion pain receptors and just receptors on our body. So right now, like he literally can't feel his left arm, and that just has to be a very surreal feeling. Okay, I'm gonna move this forward to my favorite part of the video. Let's take it right about here. Okay, so this is my favorite part. Let's pause this. So this little guy right here is his biceps tendon. So what I want you to do is, bring your arm out and make a bicep. And right in the inner elbow area, so the antecubital fossa, this part that I don't know, inner elbow, you're gonna feel like this tendon right there. So that's when he's ruptured. And that is what is going to now get packed back down to his body. And I mean, just imagine, like he probably, benches like what, 600, 500, I don't know, a lot. And it's this little tendon right there, that's all it is, that is responsible for holding his muscle down to the bone. I mean, I think that this is just brilliant. Like, the human body is just so amazing. Okay, so the good thing here is what the doctor basically is saying is that Eddie literally just tore the tendon from the insertional point, meaning the part where it inserts into the bone here. He didn't like tether his tendon at all. So one thing that I tell a lot of my patients to kind of better visualize this is, you saw the tendon. I mean, think of it as like a piece of string cheese. If you rupture the tendon in half, that's a full thickness tear. But if you like kind of peel the little strings off of the string cheese, so you can kind of, fray the little parts of your tendon. And sometimes those are really complicated and difficult to rebuild, because the integrity of the tendon, or that tendon, no longer is the same. So that's what the doctor is basically telling Eddie. And he's like, hey, it's really good that the quality of your tendon is good. And then it's just that it's lifted from the insertional point. It's not that there are tiny little microscopic tears and frays in the entire length of the tendon. So that's good. So this is a pretty cool part of the video as well. So the doctor asks him, hey, how's your pain? And Eddie says that my pain is about a 4 or so. So the general pain scale is different for a lot of institutions, but generally it's out of a scale of 1 to 10, 10 being like the worst pain that you've ever felt. So it's really important for you to be honest about your pain. So if it's really a 2 out of a 10, tell me it's a 2 out of a 10. But if it's a 7 out of 10, please don't, lie and say it's a 2 out of a 10, because that really affects your long-term prognosis. So you may then need more pain medicines on discharge, and it's just not a good thing overall. Okay, I want you to see this part with me. So Eddie over here says, blah, 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 blah. But Eddie says, there is no exact science to sedation. We got to hold up here for a second. So yeah, we've been, watching his video. I really need you to know that science is the foundation of anesthesia and the foundation of sedation. I mean, if, it wasn't an exact science, we wouldn't be able to do surgery while a person's awake. Your heart is able to sustain the entire procedure. When you look at medications that you're given, so sedatives that you're given during a procedure, concentrations are very small, like fentanyl. If you get a little bit more fentanyl, you know what happens if you get too much. So the science is so very exact that I would say that the anesthesiologists in surgery are probably the most important person in the room, because they're actually helping you stay alive with science. Oh, right here. So this guy right here in the doctor's hand, that's the button. That's the thing that's going to tack down Eddie's tendon to his bone. And I mean, just look at how tiny it is. It's so tiny. So over here, Eddie's talking about, what he expects is going to happen after surgery. And, he absolutely is correct over here. So there are a lot of benefits to having these types of peripheral nerve blocks rather than having full anesthesia, so general anesthesia. I mean, one is you don't have to intubate, so there's no, airway issues. The second is you actually have a lot less pain if you have this type of regional pain block during your surgery or prior to your surgery. So again, really decreases the likelihood that a person may need long-term narcotics for this. And the pain in itself is a lot less also. So the recovery time is also a lot faster, a lot sooner, and the person is up and about and is able to do, all the things that they want to do. From my perspective, this really is not as stressful on the heart as general anesthesia is. So, that's another reason why a lot of physicians prefer this. We now do these types of blocks for a lot of procedures. I mean, it's not just for your biceps tendon. I mean, we can do it for your rotator cuff. You can do it for any type of knee issues. So it's used for a lot of different types of surgeries. Okay, yay, his surgery's done. He's doing well. He's up and about talking, having full conversations. He's not really going to have any of the, side effects of having general anesthesia. You usually could be really groggy. It could take you a really long time to wake up. You could have problems urinating. Sometimes people can develop fevers or they can develop pneumonia because of the surgery itself. So again, if you have the choice, have a conversation obviously with your doctor, but if you have the choice, the regional blocks are much better if it's allowed. The regional pain blocks are much better. Okay, so he's talking about the physical therapy and how he's going to recover and, how fast he's going to be able to return back to play. So that was it. I hope you had a lot of fun. I had a lot of fun making this video, and I hope you learned something together. For more stuff like this, subscribe to my newsletter. We talk about the day's top health and medical news. I have a great team of physicians that help write it, and we provide medical facts, not fake facts. Peace. I'm Dr. Puja. Bye.